topic is intimacy and relationships after cancer, and we are lucky enough to be joined with Emily Szafara, you might know from the Chelsea Center. The description of today's talk is that cancer and chronic illness can have a significant impact on sex, intimacy, and relationships. Guidance on personal intimacy during cancer can help you to explore, understand, and combat these challenges. Join us in talking with Emily Szafara, LMSW, OSWC, a trained sex therapist, about personal intimacy and common relational issues that arise during cancer, diagnosis, treatment, and beyond. A little bit about Emily. Emily is a gynecologic oncology social worker at the Mount Sinai Chelsea Blavatnik Family Chelsea Medical Center. She runs the Mount Sinai Chelsea Personal Intimacy Counseling Clinic, which offers individual patient consultations every other Thursday. If you're interested in connecting, please reach out to Emily. Her cell phone number is 347-964-3093, and her email, this information we will provide you again later on. So Emily, thank you so much for joining us, and the floor is yours.
Okay, thank you so much for the introduction, and everybody for joining me. This is very exciting. So yeah, today we're going to talk about intimacy and relationships after cancer. So let's get into it. I know Jillian already introduced me, but so some of this is going to be repetitive, but a little bit about me is I'm the primary gynecologic oncology social worker at the Chelsea Center. I'm sure there's some familiar faces here, so excited to see everybody and the new faces. I've been in this position for about 3 years, so I was really drawn to sex therapy based on my day-to-day work with all of you guys, with the patients, because my role is really to help patients pre-diagnosis, at diagnosis, through surgery, treatment, survivorship, all of that. And I felt that there was a real gap, I guess, in addressing sexuality, intimacy changes, and sexual health overall, just pre and post treatment. So I took it upon myself to kind of go back to school for sex therapy at the Ackerman Institute for the Family here in New York, and kind of take what I had learned there, bring it back to Sinai, and develop the Mount Sinai Personal Intimacy Counseling Clinic that Jillian had mentioned. And I'll talk a little bit more about that later on as well, so that if any of you guys want some individual FaceTime with me, we can get you connected there. So what are we talking about today? Today we're going to be talking about sex, intimacy, and relationships. It's no secret, as I'm sure you all know, that cancer and chronic illness in general can have a really significant impact on sex, intimacy, and relationships overall. But not all hope is lost, right? Because guidance on these things during cancer, before and during and after, can really help you to explore, understand, and combat some of the challenges that you might be facing. So let me see if I can get rid of these. I don't know if you can see my faces, but hopefully they're gone now. Today, I'm going to be talking about, first and foremost, what is intimacy? What does intimacy look like? And what are the 4 kind of main types of intimacy at play? Then I'm going to touch on some common changes to sex, intimacy, and relationships after a cancer diagnosis, and hopefully normalize some of these things for you all. These can really span across different themes. Some are emotional, some are physical, some are relational. So more about all of that to come. And then most importantly, I'm going to talk about some tips and tools to navigate these changes, and how I really encourage you to reestablish intimacy through 3 main things, which are patience, exploration, and support. So I really want to start off, if there's any brave people in the audience, just by opening the floor to hear, what does intimacy mean to you? When you think of intimacy, what comes to mind? Feel free to maybe raise your hand, shout it out if you don't want to come on camera, type in the chat. I can see if anybody's in there. But what does intimacy mean to people here?
Well, I think I usually attribute intimacy to really with sex, which I know it's not, but I do think that comes to the forefront.
Yeah, exactly. That's a great point. And that's really the reason that I wanted to start off with a question, right? Because I think when we hear the word intimacy, a lot of our minds synonymously go to sex or intercourse or whatever that means. And I'm really here today to remind you all that, intimacy does not have to equal sex. For some people, maybe sex is that end goal, and that's a great goal. But you don't necessarily have to engage in that in order to feel intimacy. So let's dive a little bit deeper into that. Okay. So intimacy in general has a lot of different definitions, but when I think about intimacy, I kind of break it down into four main types or subdivisions, which are emotional, physical, spiritual, and intellectual. There are some other ones as well, but I think those are like the main four. So let's start with emotional intimacy. Emotional intimacy is defined as a close emotional bond characterized by mutual understanding, trust, vulnerability, and communication. So think of this as maybe a deep feeling of like closeness and trust. Okay. Physical intimacy. Now, this is, I think, the one that most people think about. Physical intimacy is any touch of or closeness of two or more bodies. It can be forms of contact, such as holding hands, hugging, cuddling, kissing, or sex, right? But remember, it doesn't have to be sex, because being physically intimate isn't necessarily exclusive to sexual or romantic relationships. This can also be present in platonic relationships, right? Next one, spiritual intimacy. This is defined as how you make meaning of or perceive forces beyond the physical. This may be involved in spiritual or religious experiences, depending upon the person. And this may be present in a relationship, but also doesn't have to be. And then lastly, intellectual intimacy. So I think about this as feelings of mutual understanding through shared thoughts, opinions, or ideas. This can be like philosophical discussion, or it could be just like mutual interests and hobbies. Now, let's talk about some of the things that I'm sure maybe you guys are all curious about, or maybe what brought you to the session today, which is how these different types of intimacy can really be impacted by a diagnosis. Now, I'm not familiar with everybody who's on the call. So if there's anybody who's newly diagnosed, I don't want this list to scare you. I know it can be a lot. And the reason I really mention these things is not because all of these things are going to happen to you. It's not a guarantee that all of these things will happen. But I think it's really important to normalize a lot of these things and also to bring awareness of them if you are newly diagnosed or if you're not. Maybe you're in the beginning stages, but really to get everybody to start thinking about what tools and tips you might need to combat some of these things, or some questions that you might have about some of these side effects or things that could come up. So again, let's start with the emotional side. So for some people, cancer may bring on some emotional impact. First and foremost, one of the big ones are sad or depressed feelings. Maybe this is because of a grieving process. I think grieving is so connected with cancer and chronic illness. So maybe we're just not feeling ourselves from an emotional standpoint because we're feeling sad or depressed and we're grieving something. Maybe this is because of some hormonal changes, right? Due to your diagnosis or treatment. All very common. Next is anxiety about physical changes. I'm sure you all know that cancer can bring on a lot of physical changes in the way that you look and maybe how you discuss looks or physical changes with a potential or present partner. That can be really connected with emotional intimacy. 3, stress in your relationship. All relationships have stress, right? But maybe diagnosis has created a dynamic shift in your sexual or emotional intimate relationships. And that stress leaves you really not feeling connected emotionally. Maybe this is due to some financial changes or some role changes, fears that have maybe bottled up, but stress is super, super common. And then lastly, changes in self-esteem or view. Again, maybe this is you're feeling ill because of treatment. Maybe it's because of a hysterectomy or a mastectomy or hair loss, weight changes. Very, very common themes because your image is so closely connected with your identity as a person, not even just in relationships, at work, at home. And maybe you're questioning things or feeling things that you haven't felt before. And you're really not feeling connected with yourself, let alone somebody else. So all very normal. Now let's move on to physical. So physical intimacy, I think, is the one that most people think about when they think about how cancer can impact a sexual or intimate relationship. So big ones, loss of desire. Maybe this creates difficulty feeling sexual excitement or pleasure during or about sex. This can also be really connected with low libido. A little fact, okay? So low libido after cancer treatment is reported by up to 65% of female cancer patients and survivors. So think about that, 65%. That's a really, really big percentage. And I'm sure that's even maybe underrepresented. So I just point that out to show that you're really not alone in this if low libido is something that resonates with you. Next, difficulty with orgasm, vaginal dryness and tightness, and negative thoughts and feelings about sex. Maybe this is connected to some feelings of pain in your genital area when it's touched, or pain during sexual intercourse. But those are some physical intimacy changes. Now, spiritual. For partners who connect and share a really common value in a spiritual level, a cancer diagnosis can lead to a lot of things. Maybe some questioning or some feelings of punishment, commonly connected with fertility changes, I would say. And on a spiritual level, maybe there's some shame in discussing sexual issues due to the values that you were brought up with, and that's completely normal. That's where the cultural aspect of things really comes into play. And lastly, maybe diagnosis has changed your perspectives on things, or really just changed things, good or bad, in your beliefs or values. And that can really impact your spiritual intimacy with a partner or with yourself. And then lastly, intellectual. So dependent upon diagnosis or treatment, maybe there are some cognitive problems or changes that have come up in your thinking patterns. Maybe there's a lack of communication. But the biggest thing that I would say that I see for people is really just not knowing where to start when it comes to how cancer can impact intimacy. So, the biggest questions I get asked are really like, how do I remain intimate, or how do I get back into intimacy when pain is there, when sex is uncomfortable, when it doesn't feel like it did before, and I feel so different emotionally, physically, relationally. So when I think about kind of regaining intimacy, there are 3 words that come to mind. And I mentioned them before, I'll mention them again, and it's patience, exploration, and support. So, 1, patience. I know it sounds pretty self-explanatory, but I know from the work that I do with individuals and with couples that this first step is so much harder than people imagine. So I really encourage everybody to start with patience. Now, how do you do this? First and foremost, give yourself some time. Be patient with yourself and with your partner as you rediscover what like an optimal sexual health experience looks like for you after diagnosis. It really takes time. It really does, to recover emotionally and explore what this new normal is going to be. So you really need to just be patient with yourself physically and mentally as you recover from something that's really, really traumatic. And again, maybe there's a part of a grieving process there, and grieving takes time. So give yourself that time.
Somebody ring the bell. Wait, somebody coming. What? Somebody ring the bell. Oh.
Sorry about that. Okay, so moving on to 2. Kind of the same as being patient and giving yourself time, but taking it slow. Try not to pressure yourself into the traditional thinking of like intimacy is sex and sex is orgasm, right? Try to reframe your goal into getting as much pleasure as possible. And pleasure can span across those 4 different levels of intimacy, right? Emotional, physical, spiritual, intellectual. So take it slow and try not to pressure yourself. Focus on intimacy as a whole. And lastly, make adjustments as needed. Now, I'm sure you all remember, like from your first sexual experiences, that there have been so many adjustments that have needed to happen from like your first sexual experience up till where you are now, right? Nobody's an expert right off the bat. That's totally okay. So make adjustments as needed, whether individual or partnered. You might not get it right the first time, and that's totally okay. You're going to have to stop and start and do it over a lot. So try to look at it through a patient's perspective as a way to rediscover each other if possible. Now, moving on to rediscovering. The next step is to explore. And whether individual or partnered, again, I always like to say to think about intimacy without expectations. Now, again, how do you do this? First and foremost, it sounds kind of counterintuitive, but we take sex off the table. In sex therapy, there's an amazing therapeutic exercise called sensate focus. Most people haven't heard of it, and that's totally fine. But its goal really is to improve intimacy and communication between partners around sex, anxiety, and shifting away from that ingrained goal-oriented or orgasm-oriented sexual patterns. So it's a really, I would say, rather focused and intensive therapeutic exercise. So I wouldn't encourage maybe like Googling and trying it out without the guidance of a trained sex therapist. But there are so many avenues to implement it that are really, really simple and effective. And that's why I mention it. So for example, setting aside maybe 15, 20, 30 minutes, whatever you can spare, with yourself or with a partner to engage in mutual touching without distractions, okay? Maybe this is done in your undergarments. Maybe this is done with clothing on or a shirt on, depending on your comfort level physically, and that's totally fine. Then one at a time, you take turns re-exploring the body without the intentions or expectations of any sexual arousal or orgasm, but rather with the mindset of just noticing the sensations that you're feeling along different parts of your body. And the whole time, as you're feeling the contact, you're communicating how each touch feels. Maybe if you're doing this individually, you're not communicating that out loud, but maybe you're noticing it and you're going to write it down later. But this really allows you to discover a new level of sensuality or rediscover a new level of sensuality and sensory appreciation without sex being on the table. So it's a really, really great thing to kind of explore. Now, other things that you can do, talking, right? Connecting on that intellectual intimacy level, quality time. Maybe you plan an activity or a date night. Or if you're individual, maybe you just take yourself out to do something that you've been wanting to do for so long. Next, cuddling, kissing, making out, massages, regular massages, sensual massages. It might be easier to kind of start off with these cuddles or these massages the first few times rather than going full blown into like a penetrative sexual experience, because it breaks intimacy down into those more emotional, spiritual, intellectual levels and helps you to kind of reconnect with yourself and your partner. Okay. Continuing with exploring, another common recommendation that I have is to establish new sexual routines. Now, in doing some of the things that I mentioned on this past slide, cuddling, kissing, taking sex off the table, you're already doing that. You're already establishing like new sexual routines and ways of prioritizing connection without even realizing it. But establishing new sexual routines kind of takes it one step further, makes it concrete. So how do we do that? We explore different sexual practices. If penetrative intercourse is difficult, maybe we try oral sex, mutual masturbation, sex toys, Maybe you explore different erogenous zones that you didn't really have at the forefront of your mind when it came to sex in the past. Maybe it's like the nape of your neck or your ear or your inner thigh. Those are all erogenous zones that can be added to your sexual practice. Maybe your new sexual practice needs some lubricants or some moisturizers. That's all very common. Maybe you need some new sexual positions, some pillows to help make certain areas feel more comfortable. That's totally fine too. Maybe you have some low libido or you're not as interested in sex, so you need a new type of intellectual stimulation. Role play, dirty talk. Maybe you need some erotic images or some stories, sexual fantasies, all different things that can be explored and kind of rewritten into your sexual menu. Now, it can be really beneficial, I would say, to take some time to explore your sexuality on your own, just so that you are able to kind of like fully understand or communicate what this new normal might be. So before you move into a partnered exploration, I encourage you to just set aside some time to explore on your own, whether it's kind of that sensei focus, just touching and recognizing at baseline what you're feeling, on your personal comfort. Think about, what does your body need to feel pleasure now? And how can we communicate that to establish a new sexual routine later? Now, I know that that's a lot of information and suggestions, probably. And a lot of you are probably thinking, maybe I do some of these things already, or where do I start with all of this? And that's totally okay. So that's why I like to talk about support. Now, I know it can feel awkward, or maybe some people are apprehensive to bring up sexual concerns to your doctors, nurses, nurse practitioners, anybody on your medical team. But nurses and doctors, your medical team is really an integral part of you getting the help and guidance you need. So that's why I really mention that advocating for yourself by speaking with them about any questions that you have is really, really imperative. Now, before an appointment, I always encourage patients, whether it's about sexual issues or not, to really write down questions and concerns that you have. Because when you bring them in, it's going to be less awkward to be like, hey, I have this list, as opposed to thinking of them off the top of your head. Talk to them about risks to sexual functioning before, during treatment, if you're concerned, right? If you've already received treatment, maybe talk to them about finding ways to treat different symptoms and concerns that you have. Now, some of the questions that I put on here are just for the kind of baseline for you, but ones that I really, really commonly have people bring up to me, so I thought they would be a good place to start. So first, how might sex or intimacy change for me as a result of your diagnosis and treatment? 2, is it safe to engage in masturbation, mutual masturbation? 3, is it safe for my partner and I to have sex during treatment, after treatment, whether it's penetrative vaginal sex, anal sex, oral sex? All great questions. Next, are there any precautions we need to take? Whether it be like protection, whether it be immunocompromised precautions, anything at all. Next, is there anything I can do to make sex more enjoyable? That's, I think, a really good blanket one that really opens up the conversation with your medical teams. And last, my favorite, are there any resources that I can connect with for guidance on these issues? Many doctors, nurses, medical teams, they're so happy when people bring this up and offer guidance. You really just have to, I think, take the first step and advocate for yourself, or find somebody like me that's a part of your medical team that can help to advocate for you. So moving on with support. Another very, very important avenue for support that we take is from our partners, current partners, potential partners. And I know this can be maybe the toughest one for some people, because not everybody's really trained and grew up to be encouraged to talk about sex in this really open way, especially sexual health concerns. But the number one thing that I want you to take out of today, if it's anything at all, is that communication is the key. It's the key to you really tackling this. So it's important to have conversations around emotional and mental well-being and talk about your sexual health when you're ready. If you don't feel ready, that's totally fine. Sometimes it's important to even communicate that you don't feel ready, right? Roles have shifted. Things have changed. It might be hard for you to focus on that emotional side of your relationship. That's where that patience aspects comes back around. But when you think about support from a current or potential partner, first and foremost, we want to try and be intentional in addressing the shift and prioritizing time to just be a couple. 2, you want to discuss creative ways to remain focused on your closeness. Maybe that's the other aspects of intimacy, right? 3, you want to share any fears that you have about resuming or continuing sexual activity. And you want to ask your partner how they're feeling. The whole way, you're going to want to validate each other's feelings. The same way that you want to feel validated, you want to validate your partner or potential partner's feelings. Maybe they're worried about physical hurt, like hurting you because you're in pain. Maybe they are scared to seem too eager to bring it up because they really want to give you your space and your time. Or maybe those are things that you're assuming. That's really common when communication is lacking. So just all things to talk about. Talk about ways in which you used to experience pleasure, what you liked, what you didn't like, what feels different, what you need. That's really important. Consider what kinds of support you want or you need now, and think about even like what level of intensity you prefer when it comes to certain pressures on your body, what positions you prefer, whether you prefer to be touched or not touched in certain areas. Anything that they can do different, communicate it. Now, continuing with support, or I guess rounding out support, I want to touch on where you can find or create support within yourself, because that's really going to help you to communicate things to others. So, first and foremost, connecting with your body, building up your confidence by connecting with your body and just making time for activities that make you feel happy or confident now. The better you feel about yourself, the more you will likely be able to relax and enjoy other levels of intimacy. So if you're having issues with relaxing or intimacy, try some mindfulness, try some body scans. There are some body scan resources out there that are specific for engaging in sexual intercourse after a chronic illness. So really great things to connect. Explore on your own, right? Maybe that's with masturbation. Maybe that's with the sensei focus or the simple touching. Exploration is a really great way. Focus on parts of your body that you're comfortable with, even if it's just one. And try focusing on pleasurable feelings or sexy thoughts or fantasies. That can all be really helpful. Now, in the same regard as connecting with your body, we want you to connect with your mind. You're all here, right? You're taking that first step and connecting with your mind and getting support. And I really appreciate that. And I want to point that out, recognize that, because that's a really big first step. Other ways to connect. Journaling is really great. Writing down what feels good, what doesn't feel good. Maybe that helps you to be able to communicate that to somebody else. So journaling. Therapy, specifically sex therapy, super helpful. That's why it's, a practice. The more connected with your mind you are, the more connected with your body and others are going to feel. Now, 2 easy ways to kind of connect with your mind. These are like my little plugs. The Woman to Woman Behavioral Health Grant, which is one of the most amazing aspects of the program. Connect with your social worker to see if you qualify for it. There's one of the providers on there, Boutique Psychotherapy, Dr. Carly Blau, who is also a trained sex therapist, and she's amazing. And I look up to her so much. So a really great way to explore some of these things if you need a little extra help. And then again, the personal intimacy counseling clinic, which I have here at the Chelsea Center. So my little plug for that. I know Jillian had mentioned it, but if you feel like you need more support in connecting, I'm here as a resource for you. I do appointments every other Thursdays in hour blocks from 9 to 12 in person, over the phone, virtual, like a video visit like this. So if you're interested in connecting, or even if you're not and you just have questions, I want you to feel like you can reach out to me. I'm here for any questions at all. That kind of like rounds out my little talking portion.